more people in, why don't we go ahead and get started. So our 11th meeting, next month, we get to celebrate our anniversary, which I feel like we should all bring a cupcake or something. It's been one of my favorite meetings of the year. So thanks all for continuing along. More folks are showing up. Okay, so like always, just a reminder of what we are here to do together today. We bring you all together to exchange knowledge on priority tribal adaptation and resilience data needs, sharing tools, practices, ideas, and lessons, exploring opportunities to develop and scale up solutions to address tribal resilience data needs. And then I threw this in there, which isn't normally there, the key objective. We have like a few of them, but this is the one that's really at the top. Like, we get together to try to improve tribal climate and health resilience data access for tribes. So our agenda is kind of like normal, although last time we had a really great meeting that was really more discussion based and just kind of checking in on our objectives and what we're doing. We are back to having some speakers today, so that's great. We get to talk with two folks from OEHA that are going to share some of their research and findings that's applicable to all the stuff we talk about in these meetings. Before we do that, we'll do our member announcements. And before we do that, I just want to see if there's anybody new here. So everybody should, if you would like to throw a brief intro into the chat, just so we can all remind each other who's here, who we are, what we do. And I think Stephanie Lewis, are you new? Will you? We like to haze our new members. No,
I am new. Good morning. My name is Stephanie Lewis. I'm with the Department of Toxic Substances Control, and I've been invited by my colleague Lori Montserrat from OEHA. Hey, Lori. I'm the tribal liaison for DTSC, engaging with tribes in California about the projects that we provide oversight for. And climate change is huge. So I wanted to be able to find out what others are saying about it and how we can share that information with our California tribes. So thanks for having me in your space.
Thank you.
Yeah, welcome. Glad you're here.
Thank you. Thank you.
We always love to get to know the tribal liaisons here in the state. And then Nicole Hernandez, I can't remember if we've talked to you before. Will you introduce yourself?
Hi, everyone. Yes, I'm new. I'm Nicole Hernandez, and I'm representing OPR, the Office of Planning and Research. I am replacing Lisa Hu for now on these meetings. Lisa Hu was the OPR representative who was developing the Vulnerable Communities platform, but she recently moved on to a new role at SGC, and so now I will be filling in. Yeah, so I will be filling in for these meetings now and listening, so we can take all of this great, discussion and information back to inform the Vulnerable Communities platform. So thank you.
Wow. Okay. Yeah. Super cool. We've been tracking what's going on in the Vulnerable Communities platform. So at some point, we'd love to hear more about it. Thanks for being here. All right. I don't see anybody else brand new. Is there anybody else who feels like they should introduce themselves? Well, what we normally do here next is to give a little space for member announcements. So that just means if there's something that's relevant to tribes, climate change, health, and particularly data and data access, that we all have a chance to share knowledge amongst each other. It could be pertaining to something happened out in the world that you're familiar with, or your own work. I'll leave some space open.
Well, I'll fill it almost immediately, just to remind folks that we do have registration, or I should say applications open for our Climate Adaptation Health Summit. And while we are focusing on tribes, people who work for tribes and tribal serving organizations, we are also accepting applications from folks from agencies who work with tribes. Mostly we're trying to avoid people who are looking to sell their services to tribes, which is something that happens. So if you're interested, I will put the link in the chat, and I know Claudia is coming, and Lori, I believe you're coming, but I don't know if did you already register or put in your application? I think you did. Yeah, so we are limiting it to 50 people, but so far, we're getting a good influx of applications. So I will put that in there, and anybody who's interested in coming, please go ahead and send us an application. And share it with other tribal serving folks that you may know. Stephanie, maybe that's something that you can do as a tribal liaison. I know there's other tribal liaisons in other California agencies, and it would be great to be able to have those conversations with some of you folks in the room as well. So there's that. And then also the Southwest Tribal Climate Change Summit, which is the Climate Science Alliance, La Jolla Band of Luiseno Indians, Institute for Tribal Environmental Professionals, and Paula, because I can't say no to anything. And that is next month. It's actually, I think, a month from today. And it's going to be at the Paula Ray Youth Camp. And this one is focusing on climate change with the theme of the fire within us. And it's going to be looking both at the traditional uses of fire as a land stewardship practice by tribes and bringing that back, and also our own internal fires, that bring us to this work. So I'll put the link for that as well. And it's the same thing where it's an application process for that. But again, if you're working with tribes, tribal serving, then you're most likely to be able to get into that event. And if you are not a tribal member or working for a tribe, there is a nominal $75 registration fee. Lori, we got your check today, which I think was actually supposed to go to the Climate Science Alliance, but don't worry, we'll figure it out.
And I think folks that are with us as speakers, they don't have to apply. So if you're with us as a speaker, you don't.
Yes, right. Oh, no, Osamu has his hand up. Osamu, go for it.
Hey, everybody. I have an update, which is that I and the epidemiologists on our team are meeting with the California Tribal Epidemiology Center, which is somehow associated with CRIB, the California Rural Indian Health Board, to talk about health data, tribal health data, and to try to understand what health data they work with and what health data they don't work with, because we're starting a process of trying to kind of figure out how we can increase health data access for tribes that we support and more broadly. So what's on our radar right now to ask them about is IHS data, whether or not they use the California Health Information Survey, or CHIS, which we fund in part. And then finally, we're curious about how much requesting of data and stats from tribal health clinics they do. So those are, if anybody has experience working with any of those data sources or with the CTEC, the California Tribal Epidemiology Center, please feel free to let me know. I'm interested to hear what your experiences have been.
We definitely do.
Great.
Yeah, we should. And so I think, we've mentioned we developed a protocol to do a data request with them for tribes to grab standard data sets that we've organized with CTEC that are relevant to climate change and health. So we should walk through that together. And it talks about the sources and all the various sources that they use when they sort of extract and compile data for anybody who's requesting it.
Great.
And
Yeah, I'd love to see that. Is that on your website, or is that, I noticed that they have a data request form for tribes. So I'm not sure who is hosting that now that you've developed it for them.
They have a general one, and we have a protocol that basically tells you how to fill out the data request to get climate related data, to get the standardized data set that we've put together. So and that is on our website. I'll grab a link and put it in the chat.
Awesome, thank you.
All right, and Shivayu, you have your hand up.
Greetings, everyone. Just shared the link for this upcoming National Integrated Heat Health Information System inaugural conference that's going to happen virtually April 26th to 28th, I believe. So registration is free. If anybody would like to, join us, listen in, participate, I think that would be great. And a more specific request, we were essentially, keeping in mind the upcoming heat season, trying to, put together a compendium of heat health prevention resources that Health and Human Services have to offer. CDC comprises a bulk of that, but then there are a lot of other resources that different agencies, different parts of HHS provide. Financial assistance for utility payments. CMS has options for using Medicare Advantage plans to provide again financial assistance to buy air conditioners and such. I haven't been very lucky in getting any specific information that IHS may be putting out there. If you are aware of anything that's specific to tribal communities, resources specific to that population around heat health prevention, if you could just sort of share that with us, we would be glad to at least incorporate that in this compendium of resources as part of the National Integrated Heat Health Information Systems webpage, NIHIS in short. So if there is something that you're aware of, if you could just send me a link, shoot me an email, we would be glad to sort of add that information into the NIHIS webpage. Thanks.
Thanks, Shubhaya. And also I'll note that I'm on a roundtable for that conference on day one, which is at 11:25 Pacific, 2:25 Eastern. And there's some great speakers as well, including some elected officials. We have, it looks like Senator Edward Markey from Massachusetts. And then David Hayes, Biden's climate advisor, is giving the keynote for that. That's what I was thinking of, Angie, where I said I had seen his name on something recently. That was it. So that's
we have the NOAA administrator, we have we have the CDC director, we have folks from FEMA. So it's the first of its kind. It would be really excited to sort of see what comes out of that. But I think the longer lasting the opportunity for greater outreach is going to be through the NIHIS website. We are sort of really trying to sort of focus and shine as much spotlight as we can on that, making it sort of the go-to resource page for USG as far as heat is concerned. If there is anything that you would like to share, I think the NIHIS organization, sort of the main committee would be really open to showcasing, curating, any heat specific information that you may want to share.
Yeah. Okay. What's the leadership of IHS? It seems like connecting you to them seems like the right way to go in terms of their resources, and I just don't know.
I mean, I've spoken to a few, and they were unaware. I've tried to sort of go through their website, and the only heat specific stuff that I find is how to make the facilities less hot, so that the facilities primarily being the health centers basically. But there hasn't been sort of any resources that I have seen specific to those communities, particularly referring to any cultural resources that might there be, which gives guidance in terms of these are the this is the way you build your house, or this is the way you and any guidance on outdoor work schedules, any guidance on similar maybe lifestyle issues, I guess. So I haven't seen anything, at least from the IHS website, but not to say that I have there is and I've missed them, or it need not be specific to any IHS resources either. It could be any other resources that other agencies and entities have developed, which NIHIS would be happy to curate those too.
We've got some stuff, but also the National Indian Health Board might be even a better place to look because they have a specific climate program.
Yep.
Great. I have a couple of announcements. Anybody else want to share though? Okay. I just want to, highlight that the state of California's climate adaptation plan has come out, and how much focus there is on vulnerable communities, and a lot of mention of Native American tribal communities, which is just really great. And I haven't yet delved in enough to really see what's in there that might prime the pump for investment in overcoming data challenges. But I'm sure it's there. From what it looks like, it would set the stage for policy priority to say, we really need to overcome some of these data challenges. So I'm excited to see it. I'm excited to see the elevation of it all in this strategy. And then coming alongside of that is a new grant from OPR. Actually, it's an adaptation planning grant that looks like it's going to serve local governments as well as tribes. So that's exciting too. We know that the BIA just recently came out with this tribal resilience grant, its latest. And so that's what funds us. We're going to be thinking strategically about what's next and some ways that we can continue to fill some of the gaps here in the ways that we can. And it might involve collaborating with some of you. So more to come. And then finally, I threw some slides in here that I was able to, I witnessed a presentation that blew my mind from Dennis Herring from NOAA, which some of you may know, and he is talking about a new concept for a program that's in sort of not in operation. It's just in concept right now. It's following an federal executive order. It's called CRIS. And just to quickly give you like a sneak peek, I'm going to let you just have all these slides because he said I could share it as broadly as I can, but it's a climate resilience information system. So it's like kind of what we're looking for in a way. It's this federal attempt at pulling together all the information in a user-friendly way so that folks can use it to make decisions, and then tailor it alongside some like locally applicable information as well. And so I'm just going to give this to you, and I just mainly wanted to make sure you're aware that something like this is under consideration at the federal government, where the EOs are taking all this metadata, the curated collection of decision relevant federal data, and trying to make it actually navigable. And so I assume it includes health, but actually I don't really know. So we're going to have a conversation with him and his team soon. We let him know that this group exists, and hopefully we get to bring them here and have a little chat about it as well. To me, that seems like a really perfect opportunity to share some of our learnings to the federal government at a place where they are really sort of trying to umbrella together all these data sort of pieces of the puzzle. All right. So there's a lot here, and you'll just have access to it, but you can see they're trying to braid together some things. Okay, so with that, thank you all for sharing. And now we are going to move into our speakers of the day. And I just want to say thank you to Zoe Varner and Lori Montserrat from OEA. Longtime members are always here, always participating, and now we get to really turn our attention to them and hear what they're doing, some of the research that they're conducting, what they're finding, and how it applies to tribes. All right, so actually, I don't know who wants to go first. Do you all want to flip a coin?
Zoe's going first.
Okay.
All right.
So you have access to sharing your screen.
I have to ask you to stop screen share. Oh, no, it's letting me do it.
Yep, you should have access. And so Zoe, tell us more about your background. And so you're going to be sharing some of your research and work that you're doing on water with OEA.
Yeah. So hold on, sorry, it's not letting me share. You see that?
Yep.
Okay, sorry. Yeah, so I'm Zoe. I'm a Master of Public Health candidate at UC Berkeley. I'm also a graduate student assistant at OEA. And I've been working with the SAFER contract, so looking at the Safe and Affordable Fund for Equity and Resilience, looking at building resilience for low-income communities of color in California and their water systems. And when I started this project, I was looking at the Human Right to Water in California, which is basically this bill as of 2012 that said all Californians have the right to safe, affordable, and clean, accessible water. And then, like I said, I work for the SAFER program, so looking at incorporating resilience for small, low-income communities of color. And I saw while I was doing this work, I was working sort of adjacent to tribal water systems, working on incorporating domestic well systems. And I saw that tribal water systems are this priority that's been repeatedly expressed by the SAFER program. However, they have not actually evaluated tribal water systems. So I was ready to jump in and like get in contact and get things going. And my advisor told me to slow down a little bit and kind of gave me sort of more of the background, which is that this is a pretty new program. And while the State Water Board has reached out to tribes regionally, they're having problems prioritizing which tribes need immediate funding and need immediate outreach. And so I decided that I was going to do that part for my capstone project. So it's my like final master's culminating project. So I took a look at the 88 sovereign tribal water systems, which are a specific EPA designation. So they're run specifically by tribal leaders who establish the governance of these water systems. And although they're within California, they don't report directly to the state of California. They report instead directly to the EPA, which has kept the state of California from evaluating these systems because they don't actually have access to the individual data for each system. And because of how low the federal water system investment is now, these tribal water systems are lacking infrastructure investment, and they end up having to balance this like affordability for the tribal communities and also with needs for infrastructure upgrades. So they don't want to have these like giant customer bills and make water unaffordable, but they also need to upgrade infrastructure, as we're seeing with a lot of water systems throughout the US. So this is like a very basic schematic of what I'm trying to do here. This is, it's more than just the US EPA that does federal funding for tribal water systems. Also IHS, also the USDA has done some federal funding, but basically this is what the data sharing looks like. The US EPA is responsible for giving funding to individual states. And in response, these systems provide Safe Drinking Water Act data. So compliance with health-based maximum contaminant levels. And then over here, the state of California specifically gives funding to community water systems through the SAFER program, and water quality data is shared. So they're missing this component here, these dotted lines, which is what I'm trying to have some sort of, not data sharing from the tribes, but have some sort of data analysis to show that funding needs to be given or needs to be prioritized for certain systems. So my project objectives were combining relevant data sources, so this federal data, analyzing it based on modeling and looking at individual tribal water systems, and then standardizing it to create some sort of risk score to prioritize outreach for this SAFER program. So which tribes they really need to reach out to. And the data sources I used are the State Water Board's groundwater ambient monitoring assessment, and then looked at tribal boundaries from US Census, and then specifically looked at the environmental compliance history online to the ECHO system, which is the Safe Drinking Water Act dashboard, and looked at a safe drinking water information system. So for exposures, this is the groundwater that these tribal water systems are actually exposed to. I modeled that by looking at the public land survey section, which is this grid that runs throughout California. This is a specific example with arsenic levels, and this is a time-weighted average over 2011 to 2019. Here is a violation of the maximum contaminant level, so above federally safe levels. And I clipped it to tribal boundaries. So this is just an example, but I did this for each tribal boundary that I had. And then I assigned this as an exposure. So I'm saying that these two tribal water systems, this is not their actual location, this is just an estimation. What water I think they are actually accessing. So what water they would need to either treat or have some sort of process to remove the arsenic before delivering it to customers. And then this is maybe more relevant to the work that you do here, but this is the ECHO dashboard, so the Environmental Compliance History Online dashboard. This is for all of EPA Region 9. I filtered it here to all tribes, so this is for the most previous compliance period. And you can see the water systems by type. This is all of them, so I filtered to just California for my purposes, but you can look at by region, all tribal water systems. And then I looked at their Safe Drinking Water Act violations and enforcement. So the state has previously not looked at this data for whatever reason, because they usually look at their own state data. This is the federal data, so it is available here to look at maximum contaminant level violations. This is just an example, but this is what it looks like. You can see it's a maximum contaminant level for arsenic here, the dates or the compliance period that it was evaluated, and then the measured value and how much over the federal maximum contaminant level this value is. So how much more than the safe value this measurement was. So for each system, I did that modeling, which is the exposure score. I looked at whether I think these systems have exposure to maximum contaminant level violations, and then whether these contaminants are acute. So if they're contaminants like nitrate that have acute health effects. And then I looked at that non-compliance from the ECHO database. I looked at whether a maximum contaminant level was violated, whether these contaminants were acute, so had acute health effects, and then looked at the duration. So within the last compliance period, how many years were these systems out of compliance? And I combined that all together to an overall water quality score to rank risk that I have assessed in each of these systems. And here I have just sort of the distribution. Water quality score as 0 is that there's no risk that I established, and up to 3.5 is the highest risk. As you can see by this histogram, I think it's about 46 of the 88 sovereign systems have no issues with water quality that I established. So that's really good. And then you can see sort of this sloping off to highest ranked systems. And this is just an inset of these more crowded areas on this. So Southern California area, and then up in Humboldt, Del Norte counties. And then looking at exposure, this is pretty consistent with other water justice research that I've seen, where smaller systems are often exposed to higher levels of contaminants. And even though there are a lot of contaminants in smaller systems, there are 3 of these larger systems that serve 10,000 to 100,000 people, and they are also having issues with high exposure to contaminants, and medium systems as well. So that even though it's only 27% of these systems, 54% of the people who are served by tribal water systems are having some sort of exposure to arsenic, gross alpha, lead, nitrate, or trichloropropane. And then looking at non-compliance, so this is the actual delivered water. 23 of the tribal water systems had some sort of maximum contaminant level violation. And this is not going to add up to 23 because also many of the systems had multiples. So they had both copper violations and arsenic, or both copper and lead. And then looking at that distribution by system size, you can see that copper here is a problem both in very small systems and in large systems, which the significance I will bring up, I believe, on the next slide. Yeah, so looking at arsenic, which is associated with lung, skin, circulatory problems, and increased risk of cancer. This served, there were 19 total maximum contaminant level violations of arsenic during this time. However, they were concentrated in just 3 systems, so showing that arsenic is a pretty chronic contaminant in these systems. And then looking at lead and copper, which I grouped together because they are significantly associated with infrastructure failure. So that kind of leads back to my hypothesis of that infrastructure is a specific issue in these systems. And that copper, as I mentioned, is a specific problem in systems of all sizes, and it's the highest ranking contaminant of all contaminants during this period, which sort of shows that no matter what, these tribal systems based on size, size is not going to be a resilience factor necessarily. Larger systems, which we see throughout California, have more resilience. It's not necessarily true for tribal water systems. So the conclusions of this research is that a high percentage of these systems are serving water that has could be associated with significant health effects, chronic diseases, reproductive health concerns, and learning disabilities, and that this widespread copper exceedance shows that regardless of size or region, these systems are needing infrastructure updates, and that this has environmental justice implications, obviously, and that prioritizing outreach and funding by system size is not necessarily going to work, which is sort of how the State Water Board has done in the past, where they've said, okay, systems that are small, we're going to prioritize for funding. And that looking at it from this composite approach to assess risk is going to be the way that they should move forward with looking at assessing these systems and working specifically to increase infrastructure and build some sort of resilience with this newer infrastructure. Thanks. Oh, there's my last blank slide for you.
Ooh, thank you. Laura, you want to say something?
Hey Zoe, I know I work with you, but I didn't know about this project. I knew you were doing it, but I didn't know your results. Looks really interesting. I'm curious about the source of the contamination. I know that's not the focus, but you know, TCP is usually hazardous waste site, arsenic. I'm wondering if possibly the tribes could also use this to force cleanups, because it is not normally the tribe that created the hazardous waste site.
Yeah, absolutely. And I think even with these like naturally occurring elements like arsenic, which is the #1 contaminant in California groundwater, it's also, it shows the disparity too and need for cleanup and infrastructure update because it is created, right? It's like the groundwater is being extracted. They're also like with drought, with infrastructure or agriculture and industry is like agitating the water as well. So yeah, I think it could be used. I would hope that it could be used to for some sort of cleanup or remediation.
So
Thanks.
this is your academic work that eventually will be published, or maybe is it already published?
It is not already published. No, I'm still in the process of working on it. Yeah.
And not necessarily presented by OEHA, but using OEHA data.
Mhm.
Sounds good. I appreciate the ability to go rogue through academia where you can, 'cause that's awesome, and doing something that is probably outside of maybe where the state was willing to look under a rock. But it's really interesting. I wonder, so it sounds like you're trying to make the case for increased investment.
Mhm.
And so I was listening for if you had any ways to connect your data to climate change, maybe episodic pollution events, stormwater runoff and things like that. If there's any correlation you're able to find, just as like a way to increase, to say this is going to get even worse, I suppose is one way to say it.
Yeah.
And if you're primarily looking at water quality, or if you also have information on water security concerns from like a quantity perspective, like groundwater level.
Yeah, so I think the state right now is working with IHS specifically on drought, like systems that need drought investment. So my plan would be to combine this with a drought sort of analysis to look at how the water quality added to accessibility, added to affordability would create some sort of overall system score, which is what the system does, or the state does with community water systems, so like non-tribal systems. But I haven't directly evaluated whether I think the climate change specifically is causing these issues, but I definitely think the quantity part is like the next step for the state to evaluate. And also just to answer Serena, your question in the chat, all of this data is publicly available. So that was sort of my goal, was like that somebody else could independently look at this data and could come to these same conclusions.
So it looks like we have a question from Ben of the tricky cat on the bike.
Hey everyone,
Ben.
Zoe, that was awesome. Thanks for sharing all the work you've been doing. So I had a couple questions/comments. One is this type of work that you're doing potentially includable in the OHIA climate change indicators of California? Because I've worked with Carmen over the years on that, and it seems like this would be a really nice indicator, because I'm sure there is some connection with groundwater dependency, especially as we lose surface water in these dry conditions. Is that something that's been discussed?
Not yet, but we've got Lori here on the hot seat next, so.
Cool. And then the other thought I had is, and this kind of actually fell out of working with them a little bit, there is a neat I guess it's a kind of a running database of groundwater shortages that DWR keeps.
Yeah.
That's a spatially relevant data set, and it might be interesting to merge that with your work as well to see if people are, where's that occurring? Are we getting reports of this from tribal communities? If not, why? And how can we get more engagement from them? They may just not be aware that this is available, but it'd be really interesting to see if that data would be able to play into this a little bit as well. And I can send that information around. I made some pictures that I was hoping would make it in the report, but didn't this time. So maybe you'll be able to find some use of that. And then on the drought side, if you want any assistance with that, we're happy to help at the Western Regional Climate Center put together drought analyses to support your work. So, but thank you again for the talk.
Yeah, thanks so much. I have thought about, somebody from DWR is on the SAFER team that I'm on. So I've thought about including that, their drought risk. The hard part is some of their drought risk uses like social vulnerability indicators that I'm not sure I would have chosen necessarily to do an analysis. So, but I think I could use like their actual, the groundwater part of their evaluation. And
Awesome,
Serena,
thank you.
as your follow-up to, I did explicitly request, but was not given any data. So I did individually download this data from the website. Yeah.
And I have a quick question. I had to step away for a second there. Sorry, sometimes directors' duties call, but I don't know if you mentioned anything about the new change in the rule that came down from Interior from Secretary Holland about tribes now being able to promulgate their own water codes. And so there was this rule back in 1975, the Morton Rule, that made it difficult for tribes to get their own water quality standards and codes passed. And it looks like she's lifting the barriers to that process. And so from a water quality standpoint, obviously, since water doesn't recognize political boundaries like, tribal and state boundaries, that could definitely have some sort of an impact if tribes have their own water quality standards. What does that mean for users on the outside? And I don't know if that would end up having any implications for your work or not.
Yeah, I was not aware of that. So I really appreciate, thank you for bringing that up. Will you tell me the name of it one more time? The Morton Rule?
Well, the Morton Rule was a 1975 rule that has now been lifted. I'll scare up the press release and post that in the chat so you can see what it's about. I mean, it really has more to do with recognizing tribe sovereign rights to protect their water.
Right.
But it does have an impact because, again, things like the groundwater management, SGMA, the State Groundwater Management Act does not apply to tribes, but that doesn't mean that tribes aren't going to be affected. And this is a similar kind of a thing.
Absolutely. Yeah.
Well, I think I shared before that Jess and I are both part of a small team that's doing the California Tribal Gap Analysis on clean energy and climate change. And just to say that water has come up a lot when we talk about climate change as a big concern. And it's usually coming from the drought perspective, but infrastructure is very clearly something that tribes are thinking about, and just it hoists upon an additional set of urgency to fold that in if we're really trying to make the case for greater levels of investment. So anyway, this has been awesome. Thank you so much. And I feel like that might be even a good segue to Lori, because I know you heard some of that in your listening sessions. Do you want to, I have your slides. Let me go ahead and share screen and I will pull it back up and we'll shift over to you.
Yes, so I'm Lori Montserrat. I work with OEHA and I work with the Climate Change Indicators Group. And for 20 years, I guess, we've been doing indicators of climate change, which are these little discrete indicators that we work so very hard to have no noise at all. So if we look at drought, we don't want to look at anything but drought. And we're very careful about that. And then what we found in working with tribes is, well, that's ridiculous. It all impacts everything. And so I think as people read through these reports, what they're really going to see when they get to the tribal reports is how everything's tied together. So I'm going to back up and tell you how we started this process, how we changed, and what the results are so far. When we started this process, I'm going to be honest about it, even though it's kind of embarrassing. What we thought we would do is that we would talk to the tribes, we'd find out what their impacts of climate change were, and then we would validate those impacts with our beautiful data. And then everything would be right with the world, because we had used tribal Western science to validate the tribe's experiences. Luckily for us, we formed a working group of tribal members who pretty much told us that we were cracked for even thinking of that, and that we were ridiculous. And they were right. That's one thing that we've learned along this path is we are used to looking at maybe 100 years worth of data if we're lucky. When we talk to tribes, we have data since time immemorial. We have so much data that honestly, it's been kind of confusing even knowing what to do with some of it. But there is no way that anything we can do is going to validate tribal data. And so that was a big pivot for us. And I think an important one, because we came from this very narrow path. The other thing we thought that we would write a letter and all the tribes would just give us all their information. And the other thing we heard back from the tribes was, we don't know who you are, and we're not going to give you our data until we figure out who you are and what you're going to do with it, if you can be trusted. And so you need to start showing up, and you need to participate, and you need to listen. And that's another thing we've tried to do in this process. And I can say for myself that I haven't learned as much in my 30 years of experience with the state than I've learned in the last 3 years working with the tribes. It's been mind-blowing, and it's been the best work I've done. If you can go on to the next slide, please, Ange. So we did 8 tribe-specific reports with 8 tribes that were nice enough to want to work with us. They're each different. The layout is different for each. We offered some suggestions. Some tribes did it one way, some tribes did it another. But what you get when you look at these reports is a really lovely and scary picture of what different tribes are experiencing. From Ahmamutsun, which is they're not currently recognized tribe. And so, but their tribe has the mandate from Creator to care for the earth and all the living beings on the earth. And so, in spite of having no official land, this tribe works hard, protecting, rehabilitating, and caring for the land. And then you have the Eastern Sierra tribes, Big Pine and Bishop Paiute, who are dealing with the LA Department of Water and Power. So in addition to climate change that you'd see throughout California, LA Department of Water and Power is sucking the groundwater from beneath the tribes and shipping it to Los Angeles. And the tribes have no control over their own water, even though they have water systems, but they don't have control of it. The PM10 levels in the Eastern Sierra is higher than any place else in the nation because of the dust from what used to be the lush Owens Lake and is now a dry lake bed. But that dust blows up with the winds, and it has, it's really alkaline, and it's causing horrible problems. Schools have to be closed because of the dust levels. I live in Marin County, and I can tell you, we would not be putting up with schools having to be closed. It just wouldn't happen in Marin. but it sure is happening with the tribes, and it's allowed, and it's been going on for years. I mean, it is unconscionable what I see happening. Big Valley Pomo, they're up in Lake County. They have terrible trouble with harmful algal blooms, HABs, that is poisoning the biggest natural lake that's fully within California borders, Clear Lake. The HABs have gotten to the extent that the state smalls, not the tribal water system, but the state small systems around the lake now have super high level of cyanobacteria coming out of the taps. I mean, that is just nasty. And yet, here we're going. Karuk was fascinating to work with. This is a tribe that has 26 indicators of climate change that they've had since time immemorial, all these different species. And they're, I would say, leaders in working with cultural fire on the landscape. It's been really cool reading their report. North Fork, they're up in the mountains, Eastern Sierra, but further north. Another really interesting tribe that's had big swings in precipitation and are dealing with it. And then my favorites, Paula and Santa Ynez down in the south. There are some charts on recent data, so recent, like the last 100 years, on heat and days over 100 or over 110 degrees, which I found terrifying. And the loss of species that this tribe is seeing. And these are species that the southwestern willow flycatcher, I had never even heard of this bird, yet the tribe knew that it had been extirpated from their area. This is all data that we never would have seen. And it's really important, I think to tribes in general, but I think to everybody in California, because the tribes are seeing the connections that we've missed over the years. So the tribe reports are already, the other indicators, like the indicator that Ben's been working on with Carmen, they're still finalizing those. And I have permission to share all of the tribal reports. So if anybody would like to see them, you're welcome. Let me know which ones. Happy to share them with you. And I really owe a huge debt of gratitude to all the tribes that have been willing to work with me and answer my endless questions and go to the trouble to get permission to share their data with us, because I think that this has been so valuable. At least for me, it has. And I think for the state, it's been valuable that at least there's one organization in the state that understands that we need to show up, not just show up and take stuff from the tribes and go away and work in our little silo, but we need to show up and partner with the tribes when we're invited and be a part of instead of being away from. Thanks.
Laura, you're awesome. Thank you for that. I was looking at your website right now, trying to see whether I could find those tribal specific reports, but they're not there yet, right?
Right. The listening session reports are there. And those I think are pretty interesting as well, like little blurbs about each of the tribes that participated. We had, I think, a total of 50 tribes that participated in these listening sessions. But the individual reports aren't posted yet because they're part of the giant 600+ page climate change report. They're woven into each of the indicators and they are standalone reports.
So I'm going to open it up for other questions and things. Oh, Shabahu, and I don't think I said that correctly, but I hope I got close.
Shabahu, that's close enough. Thank you, Laurie. I was just curious, can we say anything? Is it possible to track in any of these tribes heat-related mortality and morbidity?
There aren't heat-related mortality, morbidity data in the tribal reports. No, they're not. There's an indicator on heat-related morbidity, mortality, but we didn't ask for that level of data from the tribes.
Do you think it's possible to get that information? Is that collected in any shape and form?
I'd
If
love to
not-
get that information, but I don't know if the tribes would be interested in sharing that.
Not so much, getting the data, but, at least understanding if there is a process of collecting that information. If so, what that process is. If there is, we have had, we are sort of having ongoing conversations with, the health, HRSA, which is the Health Resources Services and Administration, which, works very closely with rural communities, across the country, and, working with them, training, the staff at these primary healthcare centers across the country, mostly in rural areas, mostly in areas where the primary health center is the only source of healthcare for, many people, trying to understand, what the process is of, diagnosing, treating, heat-related illness, and understanding what that sort of, at least the clinical process is. And if there are parallels that can be drawn, that can be shared with the tribal communities, we would be happy to do that. So, asking and offering to help on that front, as you see fit.
Thank you.
Yeah, I'll just mention on that front, most tribes, at least in California, don't have their own public health departments, wouldn't have an internal epidemiologist or anybody to do environmental health work. Oftentimes we'll work with CTEC. CTEC maybe has access to collect, there might be authorized to collect information from Indian Health Service clinics where others might not. But I would say the data is most often probably not being collected in a way that's accessible. And a lot of CTEC's data really comes from other publicly accessible sources that's trimmed down, and the parameters are built for tribes, but not necessarily grabbed from tribes.
They do have the authority. They are the public health authorities for all the tribes in the U.S. for their.
But in terms of tracking,
They may not, but they provide surveillance support as they, I mean, obviously everybody's like super busy, right? But they are the ones who receive that data. Mortality, I understand, would be, there is National Center for Vital Statistics and the CDC track heat by county. But if you're looking for specifically tribal members, that could be more difficult. You could get it like for an area, but that might be more difficult to identify just based on misidentification or just small numbers. But you could start there to look at what the CDC's climate tracking, and then vital records. I mean, we look at it at our county routinely for, the county of San Diego, right? So we look at that. We don't necessarily look at specifically at tribal members, although we try. But like even ED, you don't necessarily see that many people, but we do. That's a state source for those data that comes back, goes up from the hospitals and the EDs, and then comes back down to the county.
Yeah. We've only got a couple minutes left. Are there other questions for Lori? I had one more, but I want to give other people a chance. Well, Lori, so my brain is blown with like, what do you do now with all this information? Like, how do you take what you know and package it in a way so others, so folks can use it, right? And I don't mean exploitatively, but like, so it can be of value to tribes, like to try to extract some levels, some themes. Does that, so do you back into your indicators? Do you update your indicators based on what you know now?
Absolutely. I mean, and you'll see that the indicators now weave this data in, and it stands alone, because this tribal data doesn't need our indicators to support it.
Yeah.
It stands alone, but we take that tribal data and use that to bolster the indicators that we have. We ended up doing everything exactly the opposite of the way we thought we'd do.
Yeah. So you probably know more about impacts than you ever did. Potential impacts.
Yeah. And I'm hopefully like for the tribes that haven't done adaptation plans, hopefully they'll be able to use this as a start for that adaptation plan. Those that have done plans, they might be able to use some of this as, you know, as they update their plans. And I know that some of the tribes have used, like we collected some fire data for different tribes, and some have used it as for fire adaptation grants from CAL FIRE. Hey, Osamu.
Yeah.
Yeah, I guess I had a similar question about how do you see the handoff happening for tribes that are are looking at their indicators and feeling alarmed to adaptation planning, and do you feel like that there's really a pipeline there to help walk them through the how they would go from kind of being alarmed by the indicators to taking certain actions, or do you have some sense of what still needs to be kind of assembled by the various state agencies?
Well, what I've seen is there is not a tribe that is not already taking action that I've met. The tribes are so far ahead of us in some ways because they've been seeing this and they've been acting on this information since before we even thought about asking them. And so, yes, I think that some of this data is going to be helpful in getting grants, bolstering plans. But the one thing, I was talking to a reporter and she said, what's something positive that you've learned from this? And my answer was, the tribes are going to survive. The tribes are going to be fine. I might not be, but the tribes are going to be fine. I mean, they are acting, they are powerful, they are forward thinking. And if in a lot of times we could get out of their way and, like in the Eastern Sierra, let them control their own water.
I want to invite anybody who has to go ahead and go, and anybody who wants to hang around and finish the conversation to hang around, because I can for another 5 or 10.
Hopefully that helped answer your question, Osamu. And I'm not trying to be too glib, but.
No, not at all. I mean, I think I totally agree based on my experiences with tribes so far that they, like the ones that I work with, want to do this planning and adapt and using the indicators to kind of get more resources to, and really, and they're also facing, like you're saying, barriers a lot of the times in terms of land ownership and lack of capacity and all things which have mostly been imposed on them. I think I'm wondering if you could just talk a little bit more, I know we're over now, but about the HABs related experience that you were talking about, and what your takeaways were there. Is that water system actually
it's a lake
chartered by the tribes?
No, the Clear Lake is a huge lake. It's the biggest lake in California. And if you look at like the pictures in the report, that lake was unsafe for swimming all of last year. Unsafe for all year. There wasn't a time during the year that it would be safe to swim in the year. Yet this tribe, the tribes that border Clear Lake, they have cultural events that must take place in the lake. And tribal members and non-tribal members are pulling water from the lake. There are 8 water purveyors that pull from Clear Lake and surrounds. And based on the data that Big Valley's finding from the state smalls, yuck. Just, I mean, mind-blowingly nasty. And there's the impact on the Clear Lake hitch, which is a tribally important species. It's that, I mean, the researcher that we worked with at the request of Big Valley, shared his data on the hitch, and he was like, "Oh, I'm just hoping that somebody pays attention. I've been collecting this data for years, and nobody but the tribe will listen." So it is. I mean, just considering where I live in privileged little Marin County. If we had a lake that was unsafe for swimming, oh my goodness, heads would roll. And this is Clear Lake, and we're just like, oh yeah, probably shouldn't swim there. Guess the tribe shouldn't use that water.
Yeah, I mean, that's very alarming to me because, you know, I know just from doing some HABs work in lakes in upstate New York that it can entail, you know, installing pretty expensive upgrades to water filters for water systems that are pulling from the source to get to filter out the cyanotoxins.
Yeah.
I mean, that's really alarming.
Yeah, and the state smalls aren't even, I mean, maybe they're trying. What I've heard is their filters get clogged, and so they don't change them often enough. And, you know, so far nobody's died, so it's okay.
You know, I'd really love to have a focused conversation about, you know, about water. What, okay, now we know more. What are the impacts that tribes are facing on their health and in other ways as a result of the climate changes affecting their water systems? And from there, what are those indicators? What are the tribes saying? Basically, how do you, not that we have to measure it because they're telling us it's true, but if we wanted to do trend analysis on it, if we want to see how it's moving and changing, what do we call it? How do we measure it? How do we word it? And where does the information lie?
Well, and the cultural impacts, I think, can't be undersold.
Yeah.
If your traditions must take place in a certain body of water, and you can't do that, maybe you're not going to get diabetes, but that's a huge impact.
We consider it that way, right? In our easy tool, because health is made up of cultural impacts as well. So things that affect well-being, we all consider health. Yeah. Like on your list of indicators here on health, like you could have a much longer list, right? Especially with what you're learning from tribes too, including the cultural stuff.
Yeah, it's huge. And in it was the Eastern Sierra listening session, Chairman Leonard shared that the drought was impacting the width of the elderberry canes. So it's impacting the music of the tribe. I mean, that really got to me, that like this, we've let things get so bad that it's impacting music, it's impacting activity, it's impacting food.
Yeah. You know, and in my work, especially because sometimes I'm paid to do these plans for tribes, I want to make sure there's no blind spots. So like now that we know all the places to go looking for problems, we want to predict them. We want to address now before they are, you know, we don't want to overlook them. We want to make sure that they're in there so that if we can prioritize them and we can put some investment behind it with adaptation strategies. So it's like, I really I want to translate what you know now into blind spot fixers, right? So like, so other people like me doing this work on the ground can make sure it gets into the right analyses.
Yeah, and so that tribes, I think that easy tool helps with this. That tribes really individualize their adaptation plans. Because as I have learned, if you know one tribe, you know one tribe. So don't just copy what you saw at Tule River. Do your own, because your culture is important.
Right. Well, this has been so great. Thank you so much, everybody. Is there anything else
you guys
today? Okay. Let's wrap it up here. I really appreciate you guys sharing all that with us and having a good conversation like always. We'll see you all next month.
Bye, everybody.
Thank you.